Hi, I'm Dr. Cynthia Cotés, and I'm here to talk to you about private off-label trainings for Bellafill. I'm a national trainer for Suniva, the makers of Bellafill, and have been since 2013. During that time, I've trained dozens of talented doctors and nurses in the best uses of Bellafill. But now, with more and more companies under pressure from the FDA about sticking to on-label uses in their trainings, I feel there's a real need for some private off-label trainings for this important and beautiful filler. I love to use Bellafill all over the face to do what's called full face rejuvenation, or as some people call it, the liquid lift. This approach has been around since the early days of Restylane, when it was the only filler on the market. But because it hardly lasted long enough to even get it done, it really fell out of favor. Now that we have this beautiful filler that lasts 5 years to forever, this is an excellent use for this filler, and it gives amazing results. Most patients have never heard of this approach. When you can approach a patient and tell them that they can have a non-surgical facelift that's cost-effective, non-surgical, with little to no downtime, you become a hero. It will revolutionize your practice, and it can make you whatever you want your practice to be. When I started using Bellafill in my practice, I was still doing traditional family practice as well as Botox and filler and some lasers, and I was hanging on by my fingernails from the recession that had started in late 2008. In the first year, I quintupled my gross dollars from dermal filler. That's 5 times more filler in 1 year during the recession. The next year, I doubled my practice again and became one of the first Bella Diamonds in the country. The year after that, in 2015, I was the #1 physician injector of Bellafill in the country. With the options that I'll have available to you for trainings, you can do anything from just refine a technique that you're already using, learn a new technique, or open multiple locations like I did in my next year. We'll have on the web portal individual trainings for certain areas that you can pay for and watch once or multiple times. Or you can come and spend an entire day with me and learn all of those techniques at once, as well as how to sell it to your clients, how not to scare clients off, and how to market in a new area. In addition, if you come to spend the day with me, you'll have access to all the videos so you can rewatch them. I can also act as a consultant for your own practice. If you've never had a consultant come into your practice and look at how will it work for you, or if you've gone to trainings and gotten very jazzed up about it and then haven't been able to implement once you got home, I can show you how to implement it in your practice. I've done it with other practices, and I've done it starting multiple practices for myself in new areas. A little bit more about me. I love to train, so I'll actually be having the time of my life when you're here or I'm with you, because I was a University of Washington faculty for 9 years at 2 different residency programs here in the Puget Sound, and I miss training. Training others is my passion. In addition, I know some of you may have heard scary things about Bellafill, or even experienced or seen complications from other providers or yourself. I have seen every complication there is to see. Even if I didn't cause it, which most of the time I didn't, people from all over this area and from sometimes out of state send me their complications, so I've seen everything. I know how to treat everything. I know how to prevent everything. Every complication you've heard of with Bellafill can be prevented and or resolved. There is nothing that means you have to cut this filler out. When you come to me, or especially if I come to you, I can take a look at your physical setup, how much size you need, what your marketing should look like, what your staffing should look like, and best practices, as well as how to start from a 0 patient base and become profitable in 3 to 6 months. I've also had multiple experiences in the industry over the years. Because I've been doing this for so long, I have been sued by an employee. She lost. I've been embezzled from, and I know now how to protect yourself against that and how to prevent it. Thank you for your time. I know how valuable it is. I look forward to meeting you, and if you can't come to meet me, take a look around the website and the portal for what option would work for you. You can click the link below to go and see the various pricing and options available at this time, and click back frequently because we'll be adding things frequently. Thank you so much. I'm Dr. Cynthia Cotés, near Seattle, Washington.